Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over the fundamentals of diabetic wound care. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So why do diabetic wounds occur? Okay, so when we have constant high blood glucose, it actually causes damage to our blood vessels. Okay, so our blood vessels bring oxygen and vital nutrients to our body and our tissue. So when our body isn't receiving the oxygen and the nutrients that it needs to heal, it's going to slow down the healing rate. Also, in patients with diabetes, they have a delayed white blood cell response. So our white blood cell is it's a type of cell that works against either bacteria, virus, fungi. They go at battle. Okay, so that's the function of a white blood cell. It's part of our immune system to protect us against infection. Now, they have a delayed response of white blood cells, so this means that they're more at risk for this wound to become infected with bacterial colonization. That is a lot of times why diabetic wounds go into this chronic non-healing wounds, because they have this bacterial contamination on them. Also, with diabetes, you can develop peripheral neuropathy. So this is loss of sensation, and often they get this in their feet. So this can cause damage because I've literally had a patient that had a thumbtack stuck in their shoe. They had no idea. It created this big ulcer in the bottom of their foot. They're walking around it all day. They had no idea that there was a tack sticking in their foot because they didn't have the sensation in their feet. Just improper shoes can cause ulcers. They should always be checking their shoes for rocks, always checking their feet to prevent ulcers from happening, because once a diabetic gets a foot ulcer, super hard to heal. So diagnosing a diabetic wound ulcer, they're most frequently on the lower legs or feet. That's where they happen. The symptoms is that patients a lot of times don't have feeling or have loss of sensation in their feet. They may have intermittent pain in their legs or feet, even cramps while they're walking on an incline or climbing upstairs. And they can even have pain at rest in their legs. Now, signs of on the physical exam, they're going to have dry skin a lot of the times on their lower limbs, because they're not getting the vital nutrients to the limbs. You'll have visible ulcerations on either the feet or the legs, both sometimes. Diminished peripheral pulse. So the pulse on the top of their foot, you're going to feel it not very strong. It should still be there, but it's not going to be as strong. And sometimes in advanced cases, you'll have like black toes or gangrene that you will see. So when we're investigating diabetic wounds, there are some really useful tests that we can use. So peripheral nerve tests, skin and nerve tissue biopsies, ankle brachial pulse index. So that's an ADPI. This allows us to see if there has been so much damage that sometimes when we have damage in the veins, arteries, we're not getting proper blood flow. And so if we do an ADPI, this will allow us to see if we're actually getting the blood flow to that area. So that's a really, really important test. It's actually really important for anyone who has any type of leg ulcer to have an ABPI done. Wound culture is another very important test because once again, they're at high risk of infection, and we want to make sure that we're catching infections right away. I have seen more times than none that diabetic ulcers turn into bone infections, okay? And that is a complete disaster with diabetic patients. We do not want a bone infection. Just so many complications with that. They're on antibiotics for at least 6 weeks, and that's IV antibiotics. Not something we want. So wound culture is super important. Checking random and fasting blood glucose, because we want to make sure that we're optimizing our blood sugars, okay? We're getting our A1C checked, making sure that we're within normal ranges. This will help heal, okay? Nerve conduction studies, MRI, Dopplers, all super important, all tests that we can use to help investigate our diabetic wounds. So effective management strategies. This is going to be long term because diabetic ulcers are not something that heal quickly. They do take a long time to heal. They do need a team of multidisciplinary professionals to help look at the patient as a whole person. Because yes, they have a hole in their foot, but we can't just look, and this goes for any wound. We cannot just look at the wound. We have to look at the patient as a whole and optimize their healing abilities. Because if we're just working on that wound, so focused on that wound, it's not going to heal as well as if we optimize their actual whole body as a whole. Okay, so local wound care solutions, debridement. This is very important with patients with diabetes because they tend to get calluses, okay, and they build up very, very quickly because there's a lot of friction on those areas where the wounds develop, and they tend to get a thick callus around the wounds. It will never heal with that callus there. The callus does need to be removed. So constant debridement and wound care dressings, wound care professionals to be monitoring this wound is definitely necessary. Okay, diet and lifestyle modifications. So we need to make sure that we're setting up our patients with a consult with a dietitian. Super, super important that they are eating properly, lots of fruits, vegetables, whole grains, to make sure that they're optimizing their nutrition. Okay, when we optimize our nutrition, we have better chances of healing wounds. So some more managements, ways to manage here. Infection control with antibiotics. So when we have a slow healing or non-healing diabetic wound, a lot of times we are going to need an antibiotic to kind of get it to start going again, because we have such a poor response of our white blood cells with diabetes. A lot of times we'll get biofilms, and with biofilms, they don't always have an outward sign of infection. So we got to be super careful with that, and just trying to recognize the signs with diabetic ulcers. Strict glycemic control also. So we want to make sure that we are properly caring for our blood sugar levels, okay? Because there has been a well-established link between poor blood sugars control and slow wound resolution, okay? Next, we have our surgical interventions. So anyone who has a diabetic wound should undergo a surgical evaluation by a vascular surgeon, just to make sure that they can, for one, have debridement, and if there's any other complications, that they are being looked after by a surgeon, okay, a vascular surgeon. Now, just some other treatments that can be of benefit are wound dressing substitutes, growth factors, wound matrix, and hyperbaric oxygen therapy. So prevention of complications, okay? We want to teach our patients that they need to be doing daily self-examinations of their limbs, okay? From day one, when somebody is diagnosed with diabetes, this should be something that is started right away, okay? So they're checking for changes to their skin color, temperature, callus formation, development of ulcers, okay? They always need to be looking at their feet. If they notice anything that is abnormal, they need to be reporting this right away to their healthcare professional. Other things that can help reduce or prevent complications is wearing protective footwear. So diabetic footwear, super, super important. Orthotics, this can be like kind of the make it or break it for diabetic feet, okay? You have to have proper fitting shoes because diabetic feet tend to be a little bit wider. We need to make sure that the shoes aren't rubbing. Regular shoes, and sometimes they can't even feel that they're very uncomfortable. I'm sure that we have all at one point had a pair of shoes that were so uncomfortable on our feet. Now imagine if you couldn't feel that sensation and how much damage it would cause. Okay, that's why good shoes, diabetic shoes, are so important. Okay, regular follow-ups with podiatrists or foot care nurses, super important. This will help monitor calluses and ulcers, and if calluses need to be removed, they can also be removed. And then just adhering to medication, dietary and lifestyle modifications, very important to keep the diabetes under control. That way it will lessen the chance of complications. So I hope this video did give you a better understanding of working with diabetic ulcers and the wound care associated with it. That's all I have for this video, and I hope to see you guys in my next one. Bye, guys.